In this second presentation, I will be explaining some of the basic ultrasound physics and in particular how this pertains to image generation. The learning objectives for this particular topic are to understand the manner of generation and detection of ultrasound, different imaging modalities that are used in echocardiography, and some of the generation of ultrasound artifacts. Ultrasound is generated as a result of the piezoelectric effect. What this refers to is that an ultrasound generating crystal, when exposed to an electrical current, will oscillate and therefore emit a sound wave. Ultrasound refers to sound waves above hearing threshold, in other words greater than 20,000 Hertz, and in medical usage ultrasound is typically in the range from 1 megahertz up to 15 megahertz. The ultrasound probe functions both as an emitter and receiver of waves. So firstly, electrical current is passed across the ultrasound crystal and ultrasound waves are emitted. The probe then waits for reflected or returning waves. I'll deal with the manner of reflection in a later component of this talk. The returning waves in turn vibrate the crystal, which causes a voltage change across the crystal which can be displayed. It's important to realise that ultrasound is a wave and as such it goes through a certain amplitude, is the result of rarefication and compression within the tissues and propagates in a linear fashion. The frequency, the wavelength and tissue propagation velocity are interrelated as shown by the equation at right, and in particular the velocity in tissues is defined as a constant. It's assumed to be 1,540 meters per second, and for most of the soft tissues of the body that holds true with minor variations. The ultrasound image relies on reflection. Reflection occurs at tissue interfaces where two tissues abut that have different density or different transmissibility of ultrasound. Not all ultrasound waves are going to be reflected, and most ultrasound energy is actually lost. This can occur due to refraction, due to attenuation, where the wave energy is converted to kinetic energy and results in heating of tissues. Scattering can occur, and also diffraction. This slide shows the interaction of ultrasound with tissues. We can see medium 1 is a tissue of a certain density, medium 2 is a change in density, a different tissue, and at that interface some of the ultrasound wave is going to be reflected. Angle of incidence and angle of reflection will be the same, so if the ultrasound beam is off axis to the interface, the reflections will pass off and not be detected by the ultrasound probe. So it's important to have the right incident angle. You'll see that some of the waves are refracted either towards midline or away. Some pass through medium 2 and may be reflected by deeper structures or go on to be attenuated and lost. It's also possible for waves to be scattered by small irregularities in tissues or small densities. The next slide shows the ways in which images are generated by reflected waves. So at left is a probe which emits a strong signal. Some of that is returned from a weak reflector. most of the signal passes through that first reflector onto the second, which is a much thicker or denser reflector. Because it's denser, only a small proportion of the energy will be able to pass through to hit the third reflector. So in order, the brightest signal or densest signal will come from the thickest reflector, the one in the middle, less from the first reflector, and much less from the deepest or furthest reflector. You can also see the influence of the constant velocity of propagation on the delay in display of deeper structures as the echoes are returned to the probe. Now, the way that the image is displayed depends on the modes of the ultrasound. First, we'll describe M mode or motion mode. This is shown here. So at the top of the screen is a parasternal long axis view of the heart. So as labelled, left ventricle on the left atrium as a deep structure, aortic root heading off towards the right of screen. Line A represents a single line of sight passing through the ventricle, and the image generated shows the left ventricular cavity. Line B passes through the mitral valve, so the motion of the mitral valve leaflets can be seen. Line C passes through the aortic valve, so here the opening and closing, opening in this section, closing here of the aortic valve can be seen. This next slide shows B mode. Now B mode is multiple lines of sight generating a fan-like image. It's what we're familiar with from our fast scanning and other uses. And I'll explain in reference to the top image again. So parasternal long axis, going back to the first one, there's a cut line going through the left ventricle. So we see the left ventricle in cross section. Now a cut line here goes through the mitral valve. So at right angles, if we were to turn the probe, we would see this image with the mitral valve opening and closing. Lastly, we're at the level of the aortic valve, and the aortic valve is seen in cross section along that line of sight of C, with 3 leaflets opening and closing. The other structures, here we have the right atrium. This flapping structure here is the tricuspid valve. This is the right ventricular outflow tract. Just faintly visible is a linear structure here that appears to open and close. That's the pulmonary valve, main pulmonary artery descending on the right of screen here. I mentioned this is the right atrium, inferior vena cava, interatrial septum, and this is the left atrium. So in summary, we've dealt with the physics of non-Doppler ultrasound modalities. In this course, we won't be dealing with any Doppler-related imaging, and we've also described the generation of B and M mode images.